From the OUTV Broadcast Center in Los Angeles, California, this is Brief News Brief, a brief look at today's trending news topics. Proudly combating the thought police since 2016, here's your host, James Heaney.
I'm James Heaney, and this is your Brief News Briefing. It's a very, very, very bad week for the U.S. as the coronavirus pandemic sweeps through the cities in the nation. The silent enemy is bringing many hospital and healthcare workers to the brink of total devastation. Yet, there are also positive revelations happening as well. Social distancing is working. Your sacrifice, staying home and Netflixing and chilling, is having a good effect. Physical separation and other restrictions are sharply reducing the projections of the death toll. Whereas just a week ago, we were being told that 100,000 American deaths would be a good thing, if you can imagine that. Now it's looking closer to 60,000 Americans, which is insane. Never should we be saying it's a good news that 60,000 Americans are going to be killed. But we're saying it only because it's not 100,000 and it's not 250,000 deaths. You have to take the glimmers of hope where you can find them. In New York, the number of hospitalizations, requirements for ICU beds, and ventilators over the past few days have stabilized and are starting to come down. Now, this is an early sign that New York is starting to flatten the curve. Here's the real piece of good news, though. Antibody tests have been developed and will be available very soon. Now, an antibody test is basically a blood test that can reveal whether someone might have had the new coronavirus without being diagnosed. Now, it's assumed that there's a vast amount of people that have been infected but were asymptomatic and didn't know it. Now, they're temporarily immune. Those people will be safer to surge to the front lines of healthcare needs and other first responders, and those people can re-enter society first. People who have been infected will likely have protection from the coronavirus for the future. Now, the antibody tests could be ready for the general public in days to weeks. Now, that's super soon. Take the good news where you can find it. Good news doesn't mean it's all clear to resume everyday activity. It means keep social distancing. You're doing the right thing. Keep doing the right thing. It's saving lives. So the rule in the coronavirus world is to keep 6 feet apart, right? Then you'll be safe? Well, new studies are saying that that's not always the case. Anyone who goes outside to exercise may need to keep an even greater distance, at least from other joggers and runners. Someone infected with the virus could pass on respiratory droplets to people more than 6 feet behind them. How? Through a kind of vacuum that they form as they cut through the air. When they're running, apparently, you're creating an area behind you called a slipstream. And it's not just running, it's cycling too, even fast walking. A jogger moving at about 2.5 miles per hour was likely to come into contact with the slipstream and thus the droplets of someone exercising as much as 50 feet ahead of them. 50 feet, not 6 feet. 50. Who knew you created a slipstream? Well, now you know. Runners and cyclists may want to avoid moving directly behind another person and falling into their slipstream. The suggestion is to just move to the side and stagger. But if you have no ability to stagger, guidelines suggest staying at least 15 feet apart when walking and 33 feet apart when running or cycling, and 65 feet if you're vigorously cycling or going really fast. Wow. It reminds me of a slipstream that's in, Sonic the Hedgehog, that new racing game, Team Racing. You want to get behind the slipstream. Actually, it's most racing video games. You get behind them in a slipstream so that you can go faster. I guess the science was always there. I just wasn't paying attention. Are we headed to the next Great Depression? The Great Depression Part 2? Jobless claims are looking like the answer to that question is yes. Last week saw 6.6 million Americans applying for unemployment benefits. That totals more than 17 million new jobless claims that have been filed in the past 4 weeks. It's a rapid, unprecedented, unsustainable escalation in unemployment. The U.S. unemployment rate has jumped 12 or 13%, making it the worst level of joblessness the nation has seen since the Great Depression. Make America's Great Depression again, right? This terrifying and startling reminder is scaring the living daylights out of economists and business people alike. prompting AG Barr to come out yesterday and say that some of the government-imposed restrictions meant to control the spread of COVID-19 were draconian and suggested that they should be eased next month. At this point, the nationwide guidelines exist through the end of April. Everyone is agreeing on that. But when and how the country will reopen again is a very controversial issue that we'll be grappling with until there's a vaccine. Barr said that when the White House's social distancing guidance expires, it will be time to consider alternative ways of protecting people. I'll give you an alternative way of protecting people, Barr. It's called a vaccine. The virus is moving across the country like a wave. Not every city is getting hit at the same time. Without proper testing, we are still mostly driving blind in many states. We have only tested roughly 1% of the U.S. population. It's going to peak in different places at different times. As much as we want jobs and working economy, we also want to be alive as Americans, right? Stay safe out there, America, and wash your hands, and don't stand so close to me.
Newsman, get your newsman. Come on, newsman, tell me the news. Tell me the news. Tell me the news. Newsman, get your newsman. Come on, newsman, tell me the news. Newsman, get your newsman. Come on, newsman, tell me the news. Tell me the news. Tell me the news. Newsman, get your newsman. Come on, newsman, tell me the news.